When I came to Cincinnati 12 years ago, I wasn't really a volunteer type of guy, but being around my doctors and my staff who are involved in all types of volunteer and charitable activities, both locally and internationally, it sort of osmotically got to me to the point where I joined, and at this point in time, I'm the executive director of the Cincinnati Eye Institute Foundation, and I'm winning an award for being a volunteer.
I was told a long time ago by one of my mentors that if you always do the very best that you can, and you take care of your patients and people like you would your loved ones, and that's going to serve you for a long time. And that's probably the best advice I got.
Having a vision is having something that you're passionate about, and St. Paul's has been an atmosphere of just enthusiasm, and in terms of empowering, I mean, you're just so empowered because people are excited about ways to help people.
We were really blessed to find out a way to really understand causes. And so that method of understanding why a problem develops before and during and after its occurrence is what we're going to apply or try to apply in this medical field for neglected tropical disease. We won't take the place of World Health, who has done a great job and an important job of getting drugs to people, but look at the actual living conditions through the eyes of the people that suffer and live there and help them actually make a difference, all the way to receiving drugs, to cleaning and treating the soil, to avoiding insect vectors, to purifying water, a whole number of things that are all in a line of process that's required to make a difference.
Well, our vision is to allow our patients to come in and have as comfortable an experience in dentistry as possible. So we deal with many, many fearful patients. People have not been in dentistry for sometimes even 30 years. And we do a lot of IV sedation. So they come in, they're able to go to sleep and just be very comfortable and have all their dental work completed.
When I think about how Cincinnati Children's has impacted healthcare, it's really been expansive. I've been at national meetings and heard about new ideas that Cincinnati Children's has already been doing for the last 5 years. So they've really been leading the field, and it makes me come back home and realize what a great place to work and how I already have skills that are advancing the field.
Certainly I'd have to say both my parents equally. My father teaching us the value of hard work and applying ourselves and doing our best at all things. I think Mom tempered that with being compassionate and kind.
My mother and father taught us as if they were one person, and their lesson to all of us was to do your very best every day and to lead by example, treat others the way you would like to be treated.
I would say that my father, Tom Reilly, had the greatest influence on me as a healthcare provider. Even though he was an accountant for Procter & Gamble for 39 years, he instilled in me the importance of working hard, trying your best, and being happy at what you're doing and striving to make the people around you do their best and be happy with what they're doing. And by working towards those goals, you're able to achieve accomplishments that you would not otherwise be able to achieve.
There's 8 brothers in the family, 6 doctors and 2 normal ones, as I tell people, and not real sure exactly how that happened, but because there's no real family history of medicine. But we all went to St. Xavier High School, who's generated their share of doctors in this region. But you know, an older one did it, but it always seemed the right choice for me individually. It wasn't so much trying to keep up with the Joneses, but it was hard work, it was exciting work, and it always seemed right to me.